COVID-19 infections in South Africa currently stands at 240, where, there are many people in this country who will seek general medical care, but many others will still be putting their faith and belief in consultations with traditional healers and traditional medicine. Let's bring in now Ayanda Mhlongo, our SABC reporter, coming to us live from KwaMaphumulo, a rural area just outside of Durban. Ayanda, a very good morning to you. What are you learning with regards to the knowledge and information that traditional healers have currently?
A very good morning to you, Blaine. And as you've said, indeed, we're coming to you from KwaMaphumulo, where over the past few days, Blaine, we've been crisscrossing the province of KwaZulu-Natal, obviously to try and speak to various communities, both rural and urban areas, just to get and gauge their understanding, firstly, of COVID-19, but more importantly, on terms of the precautionary measures. We've been stressing importance of hygiene and the importance of social distance. And in the areas that, particularly in the rural areas, what we picked up was the fact that a lot of people are saying that, hospitals and clinics are far away from where they are, but more importantly, that traditionally they often would first resort to going to traditional healers before they consult more medical professionals. And so this brings us to KwaMaphumulo, where we're in the home of, particularly in this area and in KwaZulu-Natal, a very well-known traditional healer. And he's the former chairperson of the Council of Traditional Healers, and he's still a member of the Council of Traditional Healers, Baba Ayanda Mhlongo. Baba Njomani, thank you so much for agreeing to speak to us. Obviously, just arriving here, chatting to you before coming on air. Very, very importantly, you're aware, and it seems that the members of the KZN Traditional Healers Council are aware of COVID-19, and you're now working on spreading the message that not only amongst the members of the council, but spreading to all your members. But just speak to us about what has been the response. Do you feel that the message, all the traditional healers in KwaZulu-Natal, and it's quite a big number, they are aware of this virus?
They are aware, but what worries me is that the leaders of the districts have not been called together to be told so that they report back to their members. Now, if the members at home don't know what's happening, then we are not going to succeed.
Just speak to us in terms of how you practice. One of the points that have been stressed, obviously, it's hygiene and also social distancing. And we know that your interactions as a traditional healer with your clients or patients is close contact. Firstly, whether or not you've been in communication with the health department, have any of those hygiene materials been distributed yet to the traditional healers?
They have not been distributed because even water, we don't have water in the rural areas. If you say people must wash hands, they don't have water to wash with. So that is another problem. The sanitizers also, we can no longer get them in the shops because they got finished. So traditional healers who stay away from towns cannot get them.
The other point is obviously social distance. I don't know, amongst the discussions that you've had, how are you going to go about that? I know that we've been told that when you're going to consult with a traditional healer, you sit together, and also you would want to go and possibly touch your patient. The other rituals that possibly must be done as well, which means there has to be close contact between the traditional healer and the patient. Are you coming up with ways? How are you going to go about that? What is the message that you're possibly telling other traditional healers in terms of ensuring that they are protected as well? Let's say if one of the patients who goes to them does get there and might have contracted the virus.
We started talking to traditional healers about touching their patients when we had a problem of HIV. When HIV was still very bad in the country, when we did not have anything to use for it. But now, traditional healers who are still coming very close with their patients, they're going to have a problem because there is no need for a traditional, particularly a Ninyanga. There is no need for a Ninyanga to come closer. It's only a Sangoma that can come closer sometimes if he's telling his patients about the sickness. But traditional healers have been warned long ago. Even now, I want to warn them that they mustn't come closer to their patients because they don't know whether or not those patients are sick.
Another point is that in situations like this, they're always opportunists. And I remember when you're dealing with the fight of the scourge against HIV and AIDS, I remember you were personally going area to area, warning people about people who were going around saying that they could cure HIV, and you were telling them to stop spreading messages that are wrong, that might put people's lives at risk. Have you picked up any issues around that against people who are claiming to be traditional healers, but who are going around it currently saying, yes, we can cure, this is just a flu and we can cure it?
In this country, we've got a lot of charlatans, but I know also that there are people that are going to claim to be healing coronavirus. People must not go to those people because they are going to kill them. No one has a cure right now. But we as traditional healers used to say when there is a flu in the country, there are herbs that we used to use for the flu. But we cannot guarantee that those herbs that we had or we have can heal this one. So people must not play games with this one.
Just again on rituals, as you know, many African people would want to follow certain rituals when somebody's sick, and I know that once somebody does contract the virus, they have to go into a self-isolation, quarantine, which means relatives cannot get access to that patient or shouldn't come into contact. Now, how are we going to go around? Have you thought about how do we go around in terms of those rituals that people would want to perform on one of their sick patients? Is this a discussion that you're possibly also dealing with moving forward?
I think people will have to listen. If they are told that they must not come closer to the people that are sick, they must not do so because they are also going to die. But with those rituals that need to be done, they have got to devise other means of doing that other than thinking that things are the same as last year. Things have changed.
What is it that you are hoping government can do to assist the traditional healers?
The government must have meetings with traditional healers because traditional healers need to be told. They must not just listen to people or listen to the news that this is dangerous, it's dangerous. Let the MECs and call traditional healers together. Let hospitals call traditional healers together and be told that this is dangerous. It's not like any other disease that we have ever had in this country.
Mhlongo, thank you so much for your time. The former chairperson there of the KwaZulu-Natal Traditional Healers Council, Baba Mhlongo, obviously just taking us through some of their concerns currently as traditional healers. He's saying that they have met in certain districts, but the message around awareness still has not filtered to many of their members. They are on a campaign, but he's quite concerned that they don't yet have the necessary hygiene materials, masks, sanitizers, gloves, and when traditional healers meet with their patients, they are in close contact with them. And so he's still stressing the need that while government is indeed meeting with various stakeholders, but they must not forget the traditional healers. It is quite important because many South Africans do resort, instead of going to general practitioners, Blaine, would go to the traditional healers. And this is what, of course, we've been picking up, Blaine, from many communities that we're engaging with, and they were saying, no, we will go to a traditional healer before we go to doctors.
Yeah, it's such an important aspect of the COVID-19 story to tell because, as you said, many of our people rely heavily on traditional healers here in South Africa. Ayanda, we'll leave it there. We'll try to come back to you in the next hour.